Yes, I'm there now. Are you seeing it now?
Yes,
As
okay.
full screen. Okay.
Yes, yes.
Well, good evening, everyone. Welcome to
Good
our
evening.
welcome to our evening meditation. We started last week, and the focus is the focus was coping strategies for ourselves and the young ones. That's the children. That's what we looked at last week. And for this week, we'll be looking at coping strategies for our partners and the elderly. We know family is very important to all of us. And when our families are doing well, then we can cope well, or should I say, we can do well. So we're going to look at some coping strategies during this time of COVID as it relates to our partners or our elderly. Oh, yes. For those who were here last week, you could remember some of the things that we mentioned in regards to looking coping strategies for ourselves. We looked at ensuring that we are taking care of ourselves firstly in order to be able to take care of others. Look at exercise, eating right, ensure that we're getting adequate rest, right? These are some of the things that we looked at, and some things that we could do: create a new hobby, do something different, right? So those are some of the tips that we did last week for the children. For those who had missed last week's session, we recognized that the children too, they too are stressed over what is happening in regards to COVID, and sometimes they feed from what we are doing at times. Sometimes we are so stressed that as one look at us and the children recognize that, mommy not looking right, mommy worried about something. So this too can cause our children to be even more stressful. And some important coping strategies for the children we mentioned: ensure that we're looking out for them. Yes, ensure that they're eating too. Yes, they're on the gadgets, but we also need to ensure that the time that they're spending on the gadget is not they're spending time to learn, yes, but we're also giving them time to have fun. And we're also going to ensure that it's not too much that will cause them to have any ill effects. We also talk about ways in which we can help our children to cope by giving them a pet, because as they're stressed in this time, caring for another life will also help our children to be less stressed. So some of the same things that we'll do for ourselves, we also do it for our children. And giving them a pet is one of the important things that we can do for them. But I'm looking here. See me start here with healthcare workers. Yes, I have to start here because this is the field that most of us are in. And with COVID-19, we recognize that there are higher demands in our workload. There is also include longer working hours for some persons. There are also increased patient numbers, and keeping up to date with the best practice for COVID, that too can cause us to be a little bit more stressed. So yes, our partner may be the one in the healthcare worker, but our partner may also be one that is in the healthcare field. So it's not out of place looking at the healthcare worker. We also, for the healthcare worker, again, you looked at reduced capacity to use social support due to intense work schedule or the stigma within the community towards frontline workers. So that too may cause, if our partner is in the healthcare field, to have added stress. All right. There's also insufficient personal or energy capacity to implement basic self-care. Right. So we are called upon to be everything to everyone. And guess what? We need to remember to take care of ourselves. So if your partner is in healthcare, that is double whammy. All right. We need to look out for that also with our partner. So your partner, some things that we can do to help our partner cope with this, with COVID. We are now spending more time together. This can be good, but we also recognize that this can be bad. It can be good if we plan our time, if we are making use of the time together, if we are a little bit focused on what is happening, instead of you're being home more, you're spending more time together, but you don't. It's not a scheduled thing. It's not planned. You recognize that you might be in more fuss than before, or you're not used to being in a space for long hours, so it might create another problem. But that we realize now, we need to be able to make good use of the time that we have. So, your partner, to make this time a good experience for both of you, what are the things that we need to do? Oh, simple things. You can plan your time together. So, yes, you're part of a family, but you also need to spend time together as partners to ensure that you're planning your time together, your partner time. All right. So now children are home, whether elderly parents, they too might be home, or right, and you are home. So the house now full, right? But you have to make time for each other. Plan for your special time. Find out how your partner is coping with COVID-19. Sometimes we forget everybody. We tend to forget our partners. Yes, we look about her. Oh, yes, you're big. You're strong. You're an adult. You can take care, and you find time for everybody else, not recognizing that your partner might need help too. So find out how your partner is coping with COVID-19. What are their fears? How do you what are your thoughts regarding the COVID-19 vaccine? Find out. Speak to your partner. Find out how you can strengthen each other, and that's good. Find out how your partner's thought, and yes, I mentioned that the vaccine. Take time to research factual information together. So you're at home and your social media platform is flooded with information regarding COVID-19. Some may be factual, some may be myth, but you can take time together to research the information to find out, is this factual or not? So when you do things together, that is also creating a bond. So do things together, make plans on how you will quarantine if COVID-19 should hit your home. So don't just think that COVID-19 it is out there and it will only affect those persons who are reckless or not thinking about or who are not it will only affect those people. Let me just put it in quote, those people, other persons. So make plans for yourself. What is it that I'll do if my partner should come down with COVID-19? How will isolation take place? Well, how will quarantine take place? So look at your home situation so that it is better. Sometimes for us, it might be better having the person at home, quarantine, being isolated at home, and you know that, oh, yes, he's in the room or she's next door. I'm feeling much better than having to travel to go to X place. So have these things, this discussion surrounding quarantine and isolation at home. Share ideas and ways to keep healthy together. So share ideas and also make plans and implement them together. So with COVID-19, we need to build our immune system. So we know one best perfect way in doing this exercise. So make sure that you're having exercise together. Go for a walk, holding hand in hand, whatever. That will help to build that bond together. All right. So we can think about exercising together. Get involved in things that will build you mentally. All right. So I mentioned about exercise. Make time for each other to relieve stress, right? So some simple ways. You can give your partner a massage. You don't have to go to school to know to do it. Just buy a little olive oil and take a time and rub down your partner. It might seem strange, but yes, you might not get the techniques right, but I'm pretty sure your partner will appreciate it, right? So take your time and give your partner a massage. Well, you can learn about how to do it and then give each other. And I'm pretty sure after doing that, you will be feeling much better. All right, you'll be bonding together more. Give a pedicure, give a manicure. All right. So plan the weekend. So instead of you're all at home and the children just watching TV, you and your gadget and your partner and another gadget in another room and so forth. Plan your weekend. Okay, this weekend it's massage time, or we're gonna share a pedicure, whatever. But make plans together as husband and wife, as partners. Okay, make special time. Plan for special time. All right. Yes, you might cook and you have dinner together as a family, but you can have a one day out of the week or support where you have your meals together and candlelit meal. You can do that. Pray together. Pray about things affecting the family together. When you recognize your partner's concern, don't just leave it like that, but you can take the next step dealing with it, and also taking it to the Father. All right, so pray about these issues together. Encourage each other regarding with COVID-19 to keep. We need to encourage each other to make sure that we are maintaining the COVID-19 precautions. So yes, because I love you and I don't want to take home COVID-19 to you, I'm going to ensure that when I'm at work, I am doing the right thing. And you're expecting your partner to be doing the same because you don't want to be at home and you're 6 feet. I don't know you're going to be 6 feet apart from your partner. So guess what? Guess what? The best way to protect each other to maintain the COVID-19 precaution, take the vaccine, and also so that we can enjoy life together. Ensure that you both have sufficient mask and sanitizer for the day. So you're going out, find out from a partner, do you have sufficient mask to change? You change your mask at least 4 hours, but do you have sufficient? So you put his stock or her stock together and ensure that here, honey, this is your stock for the day. Ensure that there's enough sanitizer. So you're telling the other person that you care for him or her, right? And by doing that, you're building the bond together. Take fast. I say fast from the COVID-19 news sometimes. So don't have your whole evening consume about information regarding COVID-19. So you can make your search together. When you have the facts, you don't need to be going on searching again. So take your time. Limit the time that you spend about finding information regarding COVID-19. And also ensure that your information is from reputable source. This make time, make time to still shower together. So if you're maintaining the necessary precaution, why can't you shower together? All right. So these things you still can do. All right. Take time to relieve each other's stress. I mentioned about doing the massage already. Play card games. Make make time to play with each other. Plan time to recognize or update the family album. So that's another activity that you can do. So another weekend, you're off and you're thinking about reorganizing the family album or updating the family album. So you might need to take another picture or two to put to it in order to bring it up to date. So have fun things together. So this is another thing you can do. So you can either do it together, your partner and yourself, or you can make it involving the children also. You can make it as a surprise gift for the family. So it can be just for yourself and your partner putting this album together and then present it to the family. Nice album, right? So you can do these things. Don't stop loving each other or telling each other that you love them. You might be consumed with so much things at work, at home. Some of you may be studying, but make sure that you're finding time to make love, to be there for each other, and to tell each other that you love them, all right? And do the things that makes each other feel appreciated. So these are some of the things. And if we are doing these things with our partners, do you think that this would be necessary to help your partner go through this stressful pandemic period? You can type it in the chat and let me know. So, in order to make our partners feel go through this period in a healthy way, we just have to make a concerted effort to remember them and to be there for them. So I'll be going on now to the elderly. What is it that we'll be doing for the elderly? Someone wants to say something? All right, I think somebody's mic is open. I'm not sure if this person wants to share or not. But I'll go on now to the elderly. Your elderly family members. Put yourself in their position. You're being told that COVID-19 affects the elderly and they're the one who will be ending up in ICU. They're the one who will be this condition killed. Put it that way. That's some of the things that we hear immediately. This virus mostly affects the elderly. And you're thinking about this. This condition affects me. So I'm the elderly now. Everywhere you turn here about COVID-19, I remember that affects me, the elderly. What do you think will happen to the elderly? They are going to be overly concerned about not wanting to die from COVID-19. Yes, they're going to be worried, they're going to be anxious. Some will take the necessary precaution to the T. However, the other family members may not do the same. So they will be worried. But guess what? We have to make sure that we are looking out for our elderly. We remember that they too can develop depression and at within at their age, with a matter of fact, any mental health disorder. So being worried about this added stress of COVID-19 can cause added mental health issues. So guess what? Take time to be there for your elderly family members, and not just their family members. Remember those who in the community. Explain what is happening to them regarding COVID-19. And for the elderly, you have to be patient. You cannot just tell them reel off the definition for COVID-19 and expect them to just understand it at one go. You might recognize that they'll be asking you the same question over and over and over and over. But guess what? Be patient with them. Explain what is happening, right? And we also need to observe the elderly for feeling of helplessness, or should I say hopelessness, boredom, loneliness, and depression. And this too can be due to to isolation, or to them being isolated. Because guess what? Family members might be saying, oh, yes, because it's a condition that affects the elderly, are thinking that they are the one that's going to pass it on to other persons, and they might start to treat them differently. But I'm going to ask you to remember that the elderly, they do have feelings, and they too will become worried. With this pandemic, what do we recognize? They are the first set of persons to be asked to go home, to stay home. Some might be still home. So there's a drastic shift in their regular duty. They normally up and about, going to work. And they're 75 or 65, 65, over, stay home. Sudden change. They weren't ready for this yet. They were probably trying to enjoy the last bit of their time at work. But now they're told to work from home. So they lose now. They're now, that connection with work or persons at work, not there. So we have to look out for our elderly family members. They may express fear of being separated from loved ones and the caregiver due to quarantine or isolation. And if they do express this fear, take your time to explain to them. But it doesn't mean that because they're in isolation, nobody speaks to them. No. We have to ensure that we are speaking with them. We are hearing their concerns, and we're also addressing them. There may be, with the elderly, we know that there's cognitive decline, dementia, and they may become anxious or angry. They may be stressed, agitated, and may feel withdrawn during this pandemic. But what are some of the things that we can do? We need to provide practical emotional support for our elderly during this time. COVID-19 changes older person's daily routine, as I just mentioned. But we need to remember to incorporate the elderly in the picture. I can remember just recently just trying to explain to one of my elderly church brother regarding the vaccine, because yes, the vaccine is out, and how many persons remember that? Okay, pass on the information, yes, to your church brethren or your community members. And I took the opportunity to speak to to call this person and ask, what do you feel about it? How do you feel about the vaccine? And it's available. And it took me probably about half an hour. No, not half an hour, about 45 minutes just to speak to the person, because yes, it was going over the same thing, and I have to be patient to explain. So the vaccine, does it mean when I get it, I'm going to be able to pass on COVID-19 to the other family members who are in the household and don't want to take the vaccine? So I have to go over and over and let the person know, explain regarding the vaccine. So here the person was thinking that I want the vaccine. This elderly person wants the vaccine, but is also concerned that other family members might get it if I take the vaccine. So I have to explain to him, it's not that you're taking a live virus in your body, so you won't be able to pass it on. And you thought you're thinking that is sufficient. No, I have to go over it step by step. And then not only that, but to take the necessary to go a bit further, to speak with the other family members. So that is why when you're speaking with the elderly, you have to be patient. And by speaking with the other family members and now they understand that they won't be getting it that way, then he was able to call me at 2 days' time to say, Sister Takia, I'm coming to get my vaccine. And he was able to come and get it and also to share with others. So simple things like that. You might recognize that you need to go a little bit, be a little bit more patient with your elderly, right? So their ability to stay socially connected is affected. Yes, but guess what? We can correct that. Okay, so their ability to stay socially connected is affected. But it doesn't mean that they have to be isolated from everybody. We recognize that with the elderly, yes, we have though they might have to stay at home, plan routines with them. So you know that you're going to call your elderly family members at a particular time of the day. So set the time. So whether it's going to be on weekends or 3 times for the day, make the call. You might also probably want to involve them in your devotional exercise. So do a video call for devotion to ensure that the elderly family members are a part of it. So they might not be living with you, but now they're feeling a part of it. And you can also give them things to do. So you have the younger persons in the family. You can ask grandma or grandpa, okay, grandpa, tomorrow it is you will be conducting devotion for little Johnny and Susie. So they'll be looking forward to do that. Or you're in charge of devotion tomorrow. So give them things to do. Don't just allow them to sit at home not doing anything because this is going to be frustrating for them. And this is going to drive home more depression. So be there, utilize videos. So call them, get them involved. You're going to go, you're going to also ensure that you're going to be there for them. So if they're for their medication, their prescription to be filled, you probably want to either take them to the drive them to the pharmacy and then you go in and fill the prescription for them because some of them they do want to be out too. So you take them with you and you probably be the one to go out and fill the prescription for them, get back to the vehicle and whatever. Or if that's not so, if you won't be able to do that, but ensure that the prescriptions they are filled, there are enough medication at home. You don't want to have them worried about being out of their antihypertensive medication for a week because another family member did not fill the prescription or being out of their antipsychotic medication or their whatever the medication that is. So ensure that there's sufficient medication, sufficient food at home, and get what they love. Ensure that you know their preferences and get it for them. All right. You also remember to share what is happening to the family with them. So don't just leave them out like, oh, grandpa don't need to be stressed out about what is happening. Tell them about what is happening and let them pray with you about what is happening too. And when you have good results, share it with them. So don't forget them, all right? Remember that the temporary cessation of employment and other activities can also lead to anxiety and fear. So being home, sitting home, just watching the news about COVID, being saturated with information regarding COVID from all over, you don't want to have them sitting there doing all of this. So encourage them to do something different. Start a new hobby. I mentioned about gardening last week for another group, but we too can also have our elderly being involved in this in gardening. Teach them to dance, send them exercise videos from time to time so that you can get them. They might be at home, they might not be able to go out and walk, but they can be a part of the exercise of our exercise routine. Just send them things, send them uplifting things, and don't forget to call them so that they can hear your voice. That is also important with the elderly to be able to connect to hear your voice, and also for this the little ones, tell them to call grandma and grandpa and let them whether to say grandma, I just want to tell you good morning. I'm happy that you're up. I'm happy that you're around. But make it a routine so they don't just forget. Oh, you know, it's but a 2 weeks notice, me talk to grandma. No. Make sure that there's a schedule for everybody to be connected with the elderly parents, with the elderly relatives, with the elderly family members, with your elderly community members. So you're going out and you know that you have an elderly couple living next door. You can knock on the gate, say hi, how you doing, find out what is happening. You can go when you go to the market, you take something for them too, right? So we can also think about the elderly in that way, so they don't just have to be your family members, all right? So remember the elderly wherever they are. Share simple facts about what is going on and give them clear information. Repeat the information whenever necessary. So don't be upset because you have to repeat it over and over. You have to keep on repeating it, right? Don't be upset. Don't be frustrated. Be supportive. Be empathetic to them. Keep in touch with them. Pray with them. And you should do this frequently. If they are away from you, schedule video calls and make them meaningful, especially with the younger family members, because you're forming a bond. And it is important that our elderly are connected with the younger ones. Allow them to express how they feel and also provide reassurance and comfort for them. So I mentioned about giving your partner a massage. You can also give grandma a massage. Ask the younger ones to get involved. Put your mattress out on the floor. Ask grandma to lie, rub her. Just do little things, and especially getting the younger ones to be involved. It's very important because that too helps to relieve the stress that they are going through or the anxiety that they are going through. Give them a warm cup of tea at night, right? When you teach little ones to be caring to grandma and grandpa, you're building up resources because they're learning to be loving. Limit the amount of information that they retrieve regarding COVID-19. And you want to ensure that they too are getting factual information. Walk with them. So you're going for a walk, don't always take the little ones or just you and a partner. But plan the time when you're gonna also let the elderly parents go out also for the walk. And you're going for the walk, make sure that you have the mask nearby because you want to ensure that you're going for the walk and you're not in a crowd. It's not a community where a lot of persons will be going out. If it's a community like that, ensure the mask is nearby. And if you're in a crowd, slip on the mask and you make the walk. Make grandma make the walk, and grandpa also make the walk. All right. So don't just tell them that they have to be home in the house, lock away, because this will be stressful and even cause grandma to die before even contracting COVID-19. All right. So make their favorite meals at time. All right. And you can also remember to get them involved to do it. And not because they are home, mean that you're going to leave everything to grandma or the elderly person that's at home. So you're always outside. So you give them they are responsible for cooking the meals every night, every evening. No, no, no. Yes, you're gonna get them involved in the cooking too, but give them some time when they are free from it. So you're gonna say, all right, probably 3 days for the week. Grandma, I know you want to do you love to cook and everything, but I don't want you to be cooking every night because you want them to have some time for themselves. So guess what? You will cook Monday, Wednesday, and Thursday, but I'm gonna ensure that I will be there to do, or somebody else will be there to cook also. So you give them a free time, all right, so that they can go out and do some of the things that they want to do. So don't leave everything at home because you know the elderly person is there and they will be taking care of everything. No. And we need to make sure that we are ensuring that they are feeling appreciated. So the things that they do, let them know that you're appreciative of it. All right. Be grateful and tell them thanks. Okay. Make so I mentioned about making their favorite meal. Help them to develop a new hobby. I mentioned about the dancing. Yes, the gardening. It could be to try and play an instrument, whatever it needs to do some knitting, right? So we can help them to develop a new hobby and also speak, find out how they are doing with this hobby. All right. Oh yes, I love how you knit this one. This one looks nicer. I like the color blend. Compliment them about the things that they do. All right. When they help the younger one, yes, I mentioned this part. When they help with the younger one, let them know that you appreciate their help. All right. Ensure that they are not out. This is important. Ensure that they are not out of their medication or food supply or whatever thing. So if we recognize, if we're doing these things for our elderly, I'm pretty sure they will be feeling relaxed. They will be feeling love. They will recognize that there's someone there for them. And in whatever is happening in regards to COVID-19, they may not be so overly consumed regarding all of these things concerning COVID-19 and be so overly stressed. So remember to make the elderly a part of what is happening, involve them, ensure that they are also cared for, ensure that they are not out of anything, and be there with a listening ears to listen to their concern and to help them through it. So for this evening, I spoke about the elderly family member, and I also mentioned regarding the partner. It is important to ensure that all family members are cared for during this time. It is important to recognize them. It is important to appreciate each family member. So take that little part of your day to look out for each family member. They are all unique in different ways, and they're all important to the structure called family. So ensure that we're taking the time to be there for our family members, to be there for our partners. We want to ensure that when COVID goes, we're still having a healthy relationship. We're having a healthy relationship with our partners. We're having a healthy relationship with our elderly, and we're having a healthy relationship with our children. And by doing this, we can go through this pandemic being healthy, with a healthy mind, with a healthy body. And I will always say, there's no good health. There's no health without good mental health. So let us take care of the mental health of each other. Thank you very much. And I'll now open. I'm now open for any question at this time or comment.
Good afternoon.
Good afternoon.
Hi, Carrie Brown Ellis here. That was lovely, nurse. And especially the message today was rather relevant, if for want of a better word. Quite potent. Because just yesterday I was reading the newspaper and there was an article about the divorce rate that since January, so many persons have applied for divorce here in Jamaica. So, and they're saying some of it is probably attributed to the pandemic.
Mm-hmm.
So you were telling us all these things today, talking about how to, bond with our partners. The
Mm-hmm.
information is so relevant, and you brought up some very good ideas. The olive oil, I like the olive oil part
Yes, you don't have
to
to go
get some olive
overboard.
oil and
Our little baby oil.
yes, and add a little oil and rub down and
Yes.
so it is quite relevant, and I'm happy for those tidbits. We might think that it's not necessary, but these things really help to bond. And
Yes.
when you show that you care, just putting down the mask and say, honey, these are yours for the day, I mean, that will make a big difference, where the person say, okay, you're looking out for me. So these tidbits that you gave since afternoon, they're very, very relevant, and I'm happy for that. Because like I said, when I read that news article yesterday, it was rather shocking, because it seems as if whatever is happening behind the doors, pandemic, everything, people are just going crazy and hating each other and don't want to be with each other anymore. So it's
That's it.
important that we spend time with our partners and try to work things through and come up with these things that you're saying. And the part about having that the elderly persons are our, mothers, our um in our homes, or even if we don't live with them, it's very important to look out for them. And I know that because my mom, she lives nearby. I would make sure that she always has the kids around her. She's always engaged. She was one of the persons who unfortunately was laid off, and she has not her hotel has not opened back. So we put her in our business. My husband has a business and he put her there. And she's quite engaged, and she's giving that, because at the hotel they would have been taught to carry themselves a certain way and speak to people a certain way. So she brought that to the business. And so we were very happy for her. So you can find ways to make them feel relevant. And like I said, your topic today was quite relevant. So thank you again for that. That's my piece for today. Maybe I said too much, but I was just feeling so excited about your topic. So thank
Thank
you.
you. Thank you very much, Mrs. Brown Ellis.
Okay.
I am recognizing that the information provided was it impacted you, and being able to being able to help someone else is very important, because yes, some persons might be saying, oh yes, more time at home. But if you don't plan for this time, it can be a disaster. So it is important to plan for the family time. And as I mentioned, we have to ensure that every family member, they're all been taken care of. So don't just think about the children and forget your partner. I see Dr. Johnson Campbell's hand
Dr.
is
Johnson Campbell's
raised.
hand.
You can now make your comment, Dr. Johnson Campbell, at this time.
Good afternoon. Thank you so very much. Really, I came in late, so I missed the first part, but I am looking forward to this being posted online on Facebook, because that's how I catch up the last time. I
Okay.
joined late also, but I was able to go through the entire presentation,
It
and
will be
really,
posted.
really appreciating the information, actually stealing shamelessly, because I've been asked myself to do similar presentations, which I have taken some tidbits from you. So I'm really, really commending you, Nurse Brown Lawrence. These are really practical ideas. Um, Wanting to know though, if in a situation where we find, yeah, we recognize that there is a problem, and we may not be able to deal with it ourselves, what are the resources that persons can be referred to get additional support?
Okay. Thank you very much, Dr. Johnson Campbell, for that question. It is also important that sometimes we might try everything, but with all of that, there are issues. So yes, if you still recognize that it may be your partner or the elderly persons who, in spite of trying everything, may be showing signs of not doing well, whether it be depression or anxiety, remember that you can say, call your before you can also visit your health center firstly. You can visit your health center and then let the doctor be aware that I don't think my family member is coping well because these are the things that are happening. And the doctor will take it from there, whether to refer you to the mental health professional where you can get further help, whether it be counseling or to be assessed to see what is the next step to take. But also let me mention nationally, we can also reach out to the helpline, the 888 New Life. We can make a call to that number. If you don't remember your hospital's number or being able to go to your health center, if you make that call, there are competent counselors there who will take your information and then direct you to the place nearest to you that you'll get your help. So if you're calling from, say, St. James, and you call reporting that your elderly member, family member, or your partner, these are the things that are happening to them, or they make the call, they will then get in touch with the person nearest to you. So they might be getting in touch with the mental health department, or from type 5, or that's from St. James. So they might get in touch with me. And from there now, we will take it from there. We'll get in touch with the person to get the necessary assessment for them. But also, you can also take this person to the to your A&E department. So you can take the person to A&E, whether it may be CRH, Lucy, Falmouth, whichever A&E. So if you recognize the person is not eating well, not sleeping well, now becoming very irritable, or maybe having thoughts of suicide, remember that this is now becoming a medical emergency. They're feeling hopeless. So now you recognize that the person needs help right now. If you recognize that the person is now talking about things concerning death. I don't wish to be around anymore. They might not tell you that they want to kill themselves, but you're recognizing that their thought is now they're surrounding death. You want to ensure that you can ask the person a question. Are you thinking of hurting yourself? Are you thinking of killing yourself? Find out. And from there, then you'll be able to take it you can take it to the next level, right? So take the person to the hospital, get in touch with your health professional, get in touch with the doctor at the health department, and you will get help. And I'll mention the number again, the mental health suicide prevention helpline. That number is 888 New Life, or you can also call Rise Life. All right, so this one is managed by Rise Life Services. So you can call that number. So we can, wherever we jot down our little number for any emergency, let us also have this number quite ready. 888 New Life. You want to give person a new approach to whatever they are going through. So remember, 888 New Life. Right? Thank you very much. I hope this answers your question, Dr. Johnson Campbell.
Certainly does. And just to say, Mrs. Brown Ellis, would they, for those of us on this platform or for our relatives, we could access the EAP program,
EAP
right?
program. I was gonna interject and add that part.
Yes, I don't know how I forget that part, and if Dr.
Our
Dare was here, he would
EAP
be
service
upset with me.
provider, which is led there. Yes, easily accessible by 451-5151. The number is easy to remember. 451
51, 51.
5151. And he also 51, yes. And he also counsels staff members and their immediate family members. So your elderly person live with you, your sister, your mom, whomever lives with you, your kids, your husband, your spouse, your partner. He also offers counseling service free of cost to the staff member as well as their close family members. And he does grief counseling, he does one-on-one counseling, but because of COVID, mostly it's done over the phone, but he can also make arrangements for persons who are possibly in the area where the staff is to visit the staff at a private area and have some counseling sessions. And he does a very good job. Staff would have said that. So on that note, I can testify that he has been helping our staff.
And very good. Thanks for reminding me
Yes, you were
about
saying
that
something?
part. Yes, I was just saying it's very,
Okay,
thank
yes.
you very much for reminding us about Dr. Dear. And also, as supervisors or as managers, sometimes we too might need to take the necessary steps to get Dr. Dear to our colleagues or to get him, because just recently we have um mental health department at St. James. We've had a session with him because we recognize that we have to first learn how to take care of ourselves in order to teach people how to cope with the things that is happening. And it was a very beautiful session. So yes, we can take the necessary steps to get Dr. Deere to our colleagues, right? So that's another way in which we can reach out to him, right?
Wonderful. Thank you very much. I
All right, so
have
I'm going to the numbers for Dr. Deere. It's 870-451. No, it's
876.
876
Mhm.
451 5151. And the numbers for New Life, it is, uh, I'm seeing my colleague share it in the chat, so let me ensure that it is here for everyone. I wanted to. The Rise Life Management Services, you have 967-3777. So it is 967-3777.
That's for the new life.
This is for no, not the New Life. This is Rise Life Management Services. I'm
Right to
trying
life.
to, right. So if somebody can, let me decode the one for one moment. It's not hard for me to do. So the one for the mental health suicide hotline, that number is, I mentioned, 888, and it is New Life, that is 639 for new, and then you have, so it is 639 5433. So let me go again. So it is 888 639 5433. So I'm hoping that someone got this number. All right. Good. All right. And I'm seeing some of my colleagues here who, good. Right. So it was posted by Dr. Marcia Graham. Thank you very much. So it is also posted in the chat. All right. So it's 888-639-5433. Good. Right. So thank you very much. Is there any other question or comment?
Okay. All right. So it seems that we have no further questions. Thank you again, Mrs. Von. Excellent session. Wonderful message that came across. Wonderful guidance that was given. And I see Dr. Graham mentioned this is family planning, on a new level. And I so agree, because sometimes we take or we don't really think that these simple things that we can do to reach out to, our families or spouses and our elderly, to strengthen the bond and to help everyone's mental health to improve. So thank you very much. This was a very good session. I'm seeing over 15 persons on our Facebook Live. Thank you very much for joining, for those on Facebook. And we will do this again next week, same time, same place. Right, Mrs. Lawrence?
Yes. Yes. And I want to add for just continue to spread the word to the other members of staff. Send out to when we send out to the Zoom IDs, just pass them on in your various WhatsApp groups and to those contacts in your phone to get as much persons involved. Because I'm sure there are still a lot of staff members who are not necessarily aware that we're having these awesome sessions. So as much as you can just send out the information to other persons. Tell each one, tell everybody about it so that they can all log on. All right, thank you. And it was wonderful. So I'm gonna leave now. So have yourselves rest of the afternoon, a wonderful time, and get some rest and relax and watch some TV, play some music. All right.
All right, take care, everyone. Thanks
Hey,
again.
use some olive oil.
Yes. Yes. Thank you again, everyone, and have a good evening.
Bye. Good job.
Great job.
Bye.